everyone. I'm sure you're all aware of the term that is COVID-19, and since the past few days, a term that is known as herd immunity is at rise. What is this term and what does it mean? Herd immunity is nothing but social immunity. This is actually when a population it gets immune either by a vaccine or by curing themselves, and they cure the people who are vulnerable to the disease. To make it more clear, I'll use the term chain breaker. Who are these chain breakers and what do they do? The thing is, when a contagious disease like COVID-19 occurs, it starts to form a chain reaction. And this chain reaction is impossible to stop unless we have a vaccination or we develop antibodies against the disease and we get immune. As of today, we do not have the vaccine for this disease, but there is another option if people start getting immune themselves. How is it possible? The first thing is that people, they need to get sick and then they need to recover. Once they recover, the body gets immune and it identifies the virus. The next time it tries to interrupt the body and tries to influence the body. So when more and more people they start getting immune, they start to act as chain breakers, and when they act as chain breakers, they have the capacity and they are able enough to stop the chain reaction. For example, if I am immune to the disease and I am in contact with two people, one is infected and the other one is vulnerable. He can get the virus and he can be infected. So I will be a chain breaker. I will not let the virus to transmit through me and infect my friend with the same disease, because I am immune and the virus will not have access to transmit through me to another person. So when we have enough chain breakers, I hope you're getting the point. When we have enough chain breakers, then we have the capacity to stop or eradicate the virus. There is a term that is known as R0. What is this R0? R0 is the reproduction rate of the disease, of any infectious contagious disease. The reproduction rate of this COVID-19 is 2 or 3. This means that one infected person is capable of infecting 2 or 3 more people. So when we have a lot of chain breakers, when we have a lot of immune people, this R0 or the capacity to infect 2 or 3 people will be reduced to 1 or maybe even less than 1. But to eradicate the virus or to break the chain completely is not an easy process. This step is a very wise step if we have the vaccine, but we don't. And to have enough people sick at the same time is not feasible at the moment. Why? Because if we do the math, we need at least 60% of the global population to suffer from this disease and then cure from the disease at the same time to prevent the chain reaction from spreading further. Today, the world population is approximately 7.8 billion. If we do the math, we need at least 60% of the global population to suffer from the disease at the same time. They need to cure themselves. This is not an easy process. 60% means 4 billion people, and 4 billion people getting infected at the same time is not what we can handle at the moment. Already countries are facing a major medical crisis because we do not have enough oxygen to supply to the patients, we do not have enough ventilators to provide patients, and the most important of all, if 4 billion people, if they get affected by the virus at the same time, it will be a major chaos in the world. Why? Because the doctors at the front line, they will be extremely vulnerable to this disease. Even today, although we do not have 4 billion cases, but many doctors have been affected by the virus. Some have even died protecting the patients. So if our saviors will not be safe, who is going to cure us? Who will be responsible to take care of the patients who will suffer from this disease? This is not an easy task. Many countries like UK, New Zealand, Netherlands and Australia, they are trying to induce this method of immunity, that is the herd immunity. So what they want to do is They want this disease to spread to as many people as possible. Let them suffer, let them die of the disease, and let them cure themselves. And when they cure themselves, there might be a slight chance that the people will start getting immune. And when they get immune, that will try to inhibit this chain reaction. Now, I would like you guys to think for a moment what can happen when the disease spreads in a country at such a vast level. The national health services will fall under crisis. A research analysis from the United Kingdom shows that at least 47 million people need to get sick from the disease, and then they need to recover as well, so that there may be a chance to get immune, and then they might be able to stop the chain reaction. I'm sure you're aware that when 47 million people in a country will be suffering from this virus or a disease like this, COVID-19, what adverse effects it can produce. I'm sure you can imagine the adverse effects if such big amount of people get infected at the same time. There will be a national health crisis. Where are we going to get our doctors from? The doctors will be the most vulnerable to this disease. I would like to conclude the video by asking you guys, what do you feel? What do you think about this herd immunity? And do present your views in the comments below. Thank you.